everyone, welcome to my channel, Weight Loss and Wellness. Now today I want to talk about an important topic, and that is heart health. Now that's important especially as you get older, and for women, keep in mind if you're in menopause or after menopause, you no longer have as much estrogen to protect your heart. So it's important to make sure you're taking good care of your heart. Now it's important to keep your sodium levels to 1,500 milligrams or under per day. So that's one thing you want to try to keep down is sodium best you can. It's in a lot of foods, so read the labels because it's surprising the amounts of sodium they put in things. Something else, of course, don't drink, don't smoke, exercise regularly, try to keep your stress levels down. Excess cortisol from stress in the bloodstream is not good for your heart, so do the best you can. These days it's a challenge, but try to keep your stress levels down the best you can. So something else that's important to think about that most people might not think about is dental health. Studies show, like if you have gum disease and you have bad oral health, that can get into your bloodstream and affect your heart, believe it or not. So it's important to keep your mouth clean, have good dental health. So that's important in keeping your heart healthy. Now, when it comes to cholesterol and trying to keep it down, that can also be a challenge, especially if it runs in your family. I saw my cardiologist recently, and even though I have a good diet and exercise regularly, my cholesterol is still so I'm trying to get it down, but it runs in my family. So if it runs in your family, you're the doctor said there's only so much you can do diet-wise. If it's genetic, it's genetic. So at this point, I don't have to go on anything, but I'm still trying to get it lower than it is. So a couple things that can help that is fiber. Fiber can naturally lower your cholesterol. And also spirulina. This is an antioxidant. And they did a 2008 study, and they found that those taking spirulina had lower cholesterol in the study group. This is also good for allergies and a host of other things. So this is good to take if you have cholesterol issues, and that might help lower it. So other things that can help your health, of course, is garlic. That's very good for your health. And if you want to, though, check with your doctor before you take any supplements, of course. And keep in mind that garlic can thin your blood out. So that's something you want to talk to your doctor about before you take. Now, there are two other supplements, especially if you have heart issues. These can help with stiffness in the arteries. So both of these supplements are good for that. And one is CoQ10. That's something I've started taking regularly over the last couple of months. Yes, I do take a lot of supplements, but I try to, some I rotate, some I take every day. It just depends on what the health condition is that it treats, what my age is, and what's going on and all that. So this is something I've started taking regularly, and I've given it to my mom. And when I started my mom on it, I noticed she seemed to walk better and not get out of breath as much with her COPD. But COPD, and she has some heart issues. So I noticed she seemed to walk better and do better overall when she started on the CoQ10. So maybe there's something to that. And another thing that can help with stiff arteries is vitamin K. But you want to be careful not to get too much. Now, vitamin K is naturally found in leafy greens, but if that's something you don't eat a lot of, you might want to consider a supplement. Now, this is something I'll just take a couple times a week just to make sure I'm getting enough. Keep in mind, it's a fat-soluble vitamin, so it's not something you want to get too much of. So if you're eating like a big leafy green salad, I wouldn't take a vitamin K after that because you might be getting too much. But if you're like eating not enough leafy greens and not enough in your diet, it's something you might want to consider. Again, talk to your doctor. But both of these supplements can help make your arteries more flexible. So that's important, especially if you have some heart disease. So that is what I wanted to talk about today. So thank you for tuning in. Remember to subscribe, like, and share. And I will see you next time. God bless you.